Hello viewers, welcome to Health Profile. Today we are here at Virenchi Hospital. Dr. Natesh is with us, consultant orthopedic surgeon. Hello doctor, it's pleasure having you here.
Thank you very much.
Doctor, what is chiropractic and why people are approaching it?
Chiropractic is an alternative form of medicine like physiotherapy, allopathy, homeopathy. They're all different types of medicine. Basically, they will believe in something that is causing the problem, the disease. And they will try to address that issue depending on their theory.
Okay.
And chiropractitioners, what they believe is body has got a self potential to heal.
Yeah.
And often these philosophies may overlap to a certain extent among different medical systems. And chiropractic, what they believe is a body will heal itself, and we have to just make the body, we have to just support the body to heal itself.
Okay.
For that, what they do is they'll just, usually it is chronic pains like back pain, neck pain, or chronic headaches. They are all the things that will be dealt by a chiropractor. And what he does is, usually he will release the joints in the spine and he will try to correct the curvatures of the spine. And based on that, what eventually he does is he will relax the muscles around them, paraspinal muscles, and thus he will provide immediate relief.
Doctor, what is the difference between the physiotherapy and chiropractic?
Okay, basically
Because actually they do the same.
Okay.
We don't find any difference in it actually.
Yeah. Basically, different systems of medicines, their philosophies and their the way the basic principles may overlap. Similarly, in physiotherapy and chiropractic, they do interdependently. They do it. But the thing is, in chiropractic, what they believe is body has got self potential to heal itself, and what we have to do is we have to unleash that energy or channelize that energy.
Okay.
And that's what chiropractor does. A physiotherapist, on the other hand, he will try to relax the body, train the body, increase the strength of muscles or tendons or ligaments which support movement at the joint. And in some cases, we can't draw a very clear, distinctive line role of a physiotherapist and a chiropractor, according
Doctor,
to
if
me.
we ask which one is the better, the physiotherapy one or chiropractic?
Both are good. Both are good, but the thing is, they have got both are different specialities.
Okay.
We can't say that one is good and one is not so good or so great, but definitely physiotherapists are more popular than chiropractors.
Okay. And my
People
question
who do
is,
chiropractic, yeah.
My question is, doctor, what is chiropractic and what they do actually?
Okay. Usually chirotherapists do more of spine work,
Okay.
lower back pain, neck pain, and some people even do headaches. They will handle people with recurrent headaches or continuous headaches or things like that.
With headache also they can deal?
That also they'll do.
Okay.
And chiropractors are more popular in the European nations, and it's catching up in India as well recently. Because chiropractic, it's like based on this stress environment, whatever we are living.
How it is connected to stress, doctor?
Yeah, exactly. If whenever we are under stress, what the body does is, it will try to conserve all the energy, and it will first try to put us out of stress.
Okay.
Biochemically, what happens is our glucose level, cortisol level, and cholesterol, everything increases in the body, because we need to first handle this.
When we are under the stress?
Yeah, when we are under stress. Okay. For example, if we see a tiger or a lion in this room, our first response will be to just protect ourselves from that. So all our energies will be focused on that. Our pupils will constrict, all those things. Okay. Because of, there will be a lot of biochemical responses that will happen in our body. Similarly, because of the lifestyle that we are right now, that many people, most of us are having right now, everybody is under certain amount of stress, day in and day out. And this is having a very bad effect on their diabetic status, hypertension, blood pressure, cardiac issues, and insulin management, everything. immunity, everything is getting affected very badly because of this stress that people are under. Once the people are under stress, there will be a lot of biochemical reactions supported by magnesium, and one of them is insulin, which is required for proper functioning of the magnesium. So and magnesium is also has got a very good role in muscle relaxation. So once your muscles are not relaxed properly, once you are under stress,
So, doctor, what to do these all the chemical reactions to with this chiropractic?
yeah, what a chiropractor does is he will try to relax the muscles
Okay.
manually. He will unlock the stuck joints.
Okay.
For example, in lower back or spine, neck region, there will be some joints, and these joints will be covered by capsules. And once the chiropractor forcefully releases these joints, like tries to make some movement passively, without voluntarily, we will be just lying drop dead, and the chiropractor is
Okay.
he will
That
try
lying
to
person
manipulate.
should relax his
He
muscles.
will relax his muscles
Okay.
completely, and the person who is doing it, they will unlock them.
Okay.
And you can frequently hear sounds also
Yes, yes.
from the back, and it's almost the same like when we just break our knuckles.
So, what kind of results were they
Yeah.
get?
Once we break our knuckles and all, it momentarily we will definitely feel better because of surrounding muscle relaxation and all. What they say and they feel, they proclaim is, once this thing happens, then the body will try to heal itself. Once this thing happens, the body will try to heal itself.
Okay.
And once the body heals, then
Is it proved, doctor?
Yeah, definitely it is proved.
It is proved.
Yeah, it is proved. There are some X-rays where you can see it on the internet and all other things. It is proved, and it is evidence based also. What many people what they do is they will take people with cervical. For example, most common thing is cervical lordosis. With neck pain, people with neck pain, they'll go to a chiropracticist, and when patient has come to them, they will take an X-ray lateral view of the neck. There will be a slight
So,
lordotic.
their very sensitive nerves will be there. So, it's not going to affect them.
Usually if a trained chiropracticist is there, usually they won't do any harm, but definitely, obviously, the risk of
Are there any chances of risk?
definitely there are chances of risk. And there are certain instances where there are fractures in osteoporotic people.
Okay.
When the bone strength is very weak, and the patient is elderly, and there are chances that the bone they have
So,
caused
for them, it is not recommended.
bone fractures. No, it is recommended, but the amount of pressure that the person who is manipulating the joints have to use should be ideal, because the same amount of person for a well-built 6 feet fellow will not be ideal for lean built 50 kg female. Along with that, if some patients are having severe disc prolapse in the neck or lumbar spine, then the disc may cause compression on the nerve roots, exiting nerve roots, and that may also cause some problem. So better to get evaluated first, and then go in for a properly trained person for this thing.
In this, so whatever you explained, the results comes from this therapy. So, they will not get from the medications.
Definitely they will get medication. They will get. But
then
the
why
thing is,
people are approaching to chiropractic?
Yeah, exactly. What I feel is, in medications, only just if somebody is driving a bike or a car for about 20 kilometers or 30 kilometers per day, maybe his workplace is far from his home or something, whatever the reason may be. If he is driving, definitely he'll get back pain.
Yeah.
So he'll come to me. I'll give him some medicines, and he will use those medicines, and the back pain will not be there. Back pain or neck pain will reduce until he is on medications, and until maybe some 1 week or 2 weeks more than that. But once he continuously, repeatedly does that by driving or other things, which has caused the problem, he'll again have the pain. So what usually patients feel is, so I have tried this medication, this hasn't worked, so let me try something else. So, and chiropractictionist, what he basically does is he will strengthen the muscles around the spine, or even a physiotherapist does that. Even we will say the same thing. Whatever medicines I am giving you is just for immediate relief. And either you have to reduce the amount of travel that you are doing, or you have to do some exercises to strengthen your back and neck, so that you will be capable of doing that journey, whatever journey.
Sir, is there any particular course for this chiropractic?
Yes, there are courses for chiropractitioners, but mostly 60 to 70% of the people chiropractitioners, they are being trained offhandedly by people who are already
Just watching in the internet and all.
Yeah, already watching on the internet and all, and some physiotherapists are delineating themselves as chiropractitioners, and they are doing it.
If anyone can crack our muscles, then why they need to go and pay and all, doctor?
It is control cracking. If anyone can cut you, you'll not agree. You want a surgeon.
Yeah.
Because
So
he's
that is
trained
not
in doing it.
it's completely
with
different.
Minimal damage, control
Okay.
injury.
Means
Surgery
many
is
people
nothing
will
but-
perform this kind of things at home also.
Yeah, they do
This
it. They do
cracking
it.
and all,
Yeah,
this
cracking,
twisting and all.
twisting.
Yeah.
Even in massage centers also they do this.
Yeah. Yeah. My question is that.
Yeah, even in massage centers also they do this chiropractic. They practice that, but they are not trained. Hairdresser, people who do hairdressing,
Yes.
also they'll also do this.
Yeah.
And,
Yeah. They do. They do.
It is there in our society since many years. Bone setters, the tribe of bone setters,
Okay.
the tribe of these saloon people, they have been doing this.
Yeah. Yeah.
They do this. They will, after everything is over,
We know
they do
many
some
people actually after the
they do
cutting
some
and
head
all.
massage, and
Yeah.
at the end of the head massage they will try to twist
He do
your neck.
completely body massage and back pain and all. He does that.
Yeah, usually they'll do that.
Hmm.
So it's basically it's been coming since long time.
So, doctor, my question: do you recommend them?
No, I don't recommend them, because that may cause harm to the spine and the neck or in the lower back.
Do you encourage people to go for chirotherapy?
No, I don't encourage people to go, but if they are going, I can't stop. I'll say, because whatever chiropractor does, he may be doing it out of experience, but whatever he does, like back pain or neck pain, it is always better to identify the problem and then get it evaluated and get it treated, so that based on evidence-based medicine, that is always safe and time-tested thing.
While doing this chiropractic, is there any chance of fractures?
Yes, while doing chirotherapy, if the person who is performing this, if he uses extra force or more force than that is required for that particular maneuver or so, then definitely there will be a chance of fracture. There can be a protruded disc. There can be, if at all the annulus is already torn, because of this manipulation, the disc may come out, and the degree of listhesis or degree of disc prolapse might increase.
Sir, how exactly this chiropractic is gonna cure this tensions, migraine and headache and all?
What they claim is, I have gone through some books from literature, and what the books claim is there will be some healing energy in the body, and what the chiropractor does is he will just unlock that energy, and he will try to direct all the energies for self repair of the body.
Okay.
Basically, I'll tell you, just give me 2 minutes, I'll tell you the basic philosophy of chiropractic. Because when the body has got two functions, to save itself from stress, from probable imminent danger, like as I told you, if there is a tiger or a lion in this room, there is an imminent danger. This body has to save itself from it for the moment. So the hormones and body, everything will be up and down, so that they'll come into a particular configuration which will support body to save itself from that particular day, for that particular moment. Because we are under continuous stress, most of the people are under continuous stress. The stress hormones, which are all there in the body, which must be ideally used for occasional stress incidents, occasional moments of stress have been continuously been triggering. Once all these things are getting triggered, as a response to that, one more vital function of the body, that is repairing itself,
Okay.
is getting
Yes.
hampered.
Yes.
Once the body doesn't repair itself, and on the other side you are continuously under stress, tension, and you're not allowing your body to get repaired, because when there is a tiger in this room, my body will not try to repair. My body
Yes.
will try to, my subconscious, my body, everything will try to save me from this imminent danger.
Yes. Yes.
So once in a while, the trigger of hormones is okay, stress hormones is okay, but if continuously I am being triggered by that hormones, then my body
These
repair.
days, many people are going through under
Yeah,
lot
many
of
people are
stress.
going through. So body repair is not happening properly.
Yes. Yes.
As a repercussion to that, the immunity, everything is getting deranged. So they are getting lifestyle disorders, they are getting so many other issues, and they are not being able to properly work to the full potential of their body. So there, I think this is what chiropractic basic principle is, and they claim that they are helping solve this cause.
Okay.
For example, in fibromyalgia, patients will be coming with pain here.
So can you
here,
explain
leg.
what is fibromyalgia?
Fibromyalgia is diffuse pain. Yeah, on MRI or X-ray, you will not find anything significant. It will all be normal, but the patient will be having some focal point of pain. So what they say is that is because the repairing process is not happening continuously.
Okay.
As we are talking, everybody's body just tries to repair itself, especially while we are asleep or while we are at rest. The body will try to repair itself.
People who are not so comfortable with the medication, maybe they will go to this chiropractic.
Yeah, definitely, because people will not follow, may not be able to follow or practically.
Yes.
If I ask somebody whose office is located some 30 kilometers or 40 kilometers apart, I can't ask him to just resign to your job.
Yes.
I can
definitely.
just give him some medicines,
Exactly.
and I can at the most suggest him some exercises which he must be able to find time to do, which is not in my control. He may not find time to do the exercises that I am suggesting him, and he may blame the medicines or me.
Exactly.
So he'll change me. So he'll try 3-4 people like me, and then he'll lose his hope on some form of medicine, and he will again go to some other alternative forms like homeopathy, Ayurveda, massage, chirotherapy, physiotherapy, things like that.
Okay.
And then he may find solace because he might
Yes.
might like the way
They do.
he was advised.
Yes,
he might like the way something.
They perform and all.
Yeah, he might be attracted to something out there. The procedure or the way he was taught, he was told to do things, and he will stick on to that particular regime.
Yes.
So he will find relief in there.
How often they have to do these things, doctor?
It should be a frequent thing usually.
So it is
Because
this
I don't
chiropractic is a
think-
frequent one.
Yeah. Because
Okay.
if somebody is having cervical spondylosis or mechanical back pain, then they might not have good relief with very new, with just 1, 2 or 3 sittings. That might be a prolonged issue, and they might require some prolonged treatment.
Okay.
It may be some, usually they'll give 2 sittings in a week or 3 sittings in a week or
weekly.
daily. Yeah, depending upon the severity of the condition of the patient. And the lifestyle of the patient also has to change.
In a which way, doctor?
Eventually, ideally the patient has to bring himself out of the stress environment, and he should give time for his body to repair itself. Then things will work in his favor.
So finally, what are your thoughts on this chiropractic?
Chiropractic is definitely an alternative form of handling disease and bringing out the full potential of human life. And definitely we can try that in safe hands and trained hands by trained people. And don't think that chiropractic is a solution for everything. And there is something beyond chiropractic, and definitely as there are some issues which chiropractic can handle, there are definitely some issues which chiropractic can't handle, and they have to be dealt with by a specialist.
Yeah. Thank you, doctor.
First, meditate your body, close your eyes, relax yourself. Always meditate your body.